So what Cornwall Hospice Care has done for all the people who work in it is, I think, give them huge satisfaction. So the people who come to Cornwall Hospice Care to work, a lot of them come because they believe in what we're doing, but some of them just come because it's a job. But then what they're drawn into is being part of a complex business. So there's a big business side on the organisation, but then there's the side that everybody associates with Cornwall Hospice Care, which is the actual delivery of the care. And then we have the individuals that everybody can identify, so doctors and nurses and physiotherapists and complementary therapists, all of those people. I haven't mentioned all of them, there are lots of them. But then we have an army of people like volunteers, so 1,000 volunteers each and every year in Cornwall Hospice Care, providing hours of time to support us. And that goes from the bottom of the organisation, so people coming in and sorting donated goods. That is not a pleasant job. We're really grateful for the people who come and do that. The volunteers who work in the shops and get everything ready to sell, the people who actually sell it, the van drivers and all the people who help them support it. And then we've got all the fundraisers who are supporting and doing things all the time for us to raise money so that we can go on delivering care. We've got clinical volunteers who are working in the clinical units. They're working as receptionists. They're helping with the clerical side of things, but then they're also helping with patients and with carers. We've got volunteers in community hubs helping. Our trustees are volunteers. They're people with particular expertise, but they're giving up hours and hours of time a year to support this organisation at no cost to us, but actually they're giving their personal time and expertise. So that's massive in terms of what we have. What we have are volunteers who care so deeply that they will stay with an organisation for 40 years, on a regular basis. That is huge. So, it says a lot about what it is that we're trying to do, and hopefully how the organisation supports people trying to do it, that they're prepared to do that. We have staff who give above and beyond for every individual patient every day. And sometimes that can be really hard and distressing. And what they also then do above and beyond is support each other so that they're working as a team. So I stood and made a cup of tea with a nurse and a healthcare assistant and a counsellor yesterday, and they were talking about the fact that the day before they'd met a nurse who used to work in the hospice 20 years ago. They still meet her on a regular basis, and the network of people who work in and out of Cornwall Hospice Care, have worked in Cornwall Hospice Care, is huge. And the healthcare assistant said to me, we spend more time with people we've worked with and the people we are working with than our own families. And that is a measure of what makes the organisation special and what enables people to think laterally, do things on an individual basis, go above and beyond, because it's that principle of looking after somebody as you'd want to be looked after yourself, or have one of yours looked after. And we have got countless staff and countless volunteers who do that day in, day out. It's magic.